Hey guys, it's Dr. Justin Marcagiani here. I am in Kansas City here for the 4th of July weekend. Evan, how are things hanging over there in Louisville?
Things are good. Everybody else is worried about buying fireworks and blowing stuff up. I love doing that, but since learning that fireworks are one of the biggest sources of perchlorate, which disrupts the thyroid's ability to produce hormones, I'm less interested in fireworks now.
I would just say though, if it's a one time a year thing, I would say don't let that scare you. Just hit an extra wallop of glutathione and maybe some extra sulfur amino acids, some liver tonifying herbs, maybe some activated charcoal. I think you could still enjoy doing that without the deleterious side effects. What do you think?
That's good advice. I may go do that. There's a brand of mortars that I love called Excalibur. They're
Oh
the
yeah.
biggest, the loudest, the best. I mean, like when you launch an Excalibur compared to a regular mortar, like the whole neighborhood's gonna know. I mean, it's like that sound will echo for miles. So I may do it.
Awesome, brother. Awesome. Very cool. So we'll do kind of a live Q&A here. Anyone that wants to write in, feel free. We'll hit up some questions here on today's show. We're also going to go over some lab results of Evan's local lab test here that he did with his teeth.
Yeah, my
he had a
cavitation.
cavitation procedure. We did a whole podcast on that last month. So feel free. We can chat more about that as well. So any other updates on your end, Evan? How's the Candida Summit going?
Oh, Candida Summit's good. We've got 45,000 people registered.
Oh, wow.
So we're hoping we're going to end up at like 75,000. You know, it just kind of depends on how people promote it and if they hustle as hard as they said they'll hustle to sign up, or to promote people to sign up. But I think it's going to be pretty darn successful, man. Probably not the biggest event ever. Like 100 grand, 100 grand, 100,000 participants would be cool. But I don't know.
Cool.
That's a stretch.
Oh, awesome, man. Well, we're shooting out emails for everyone. So anyone listening here now, head over to justinhealth.com/candida, justinhealth.com/candida to get signed up for the Candida Summit, where we'll have more talks like this, more in depth. That's great. Excellent.
Yeah, your talk was excellent. So I think people should really enjoy it.
Well, thanks so much. So let's dig into your results on this DNA connection lab. You had a swab done of your dental cavitation area, and we saw a whole bunch of bacteria. Let's share the screen here. Why not?
Yeah, share it.
All right, let me get this going here. Hold on.
And while you're sharing that, I'll give people a little bit of backstory here on what cavitations are, how do you identify them, how do you treat them, and what are the implications in terms of your health symptoms. So first things first, symptoms. I was having some issues with energy. I was having some heart palpitation issues, some blood pressure issues that I was talking with Dr. J about. And he's like, oh man, this is stress, or this is this. I'm like, man, I don't think it's stress. And so I ended up getting a hold of this surgeon over in Texas. There it is to your right. I don't know if you can click on it.
Yep.
I see it. All right, there it is. Oh, now you're back to me.
There we go. Can you see that there?
Yep. There it is.
Perfect.
So long story short, I was having these crazy symptoms that I thought was maybe like high iron overload, high ferritin type things, which was an inflammation problem. So I was doing some stuff like high dose fish oil and turmeric and other things to try to get the iron ferritin down. I did end up going to donate some blood, which helped. Whoa, now we've got like the Matrix.
I know, right? I think I got it fixed now. Can you see it?
Yeah, I can see it.
Perfect.
So anyway, so basically what a cavitation is it is an infection that happens into the jawbone area, into your gums, and it happens at an old extraction site. So whether this was a root canal site, whether this was a wisdom tooth extraction, whether this was a 12-year molar extraction, the membrane can be left behind in the gum and gets sewed up and it starts to rot. And then these various bacterial pathogens begin to accumulate. So you can see on Justin's screen here, anything from Streptococcus to Prevotella to Klebsiella pneumoniae, which is something we see on the stool test all the time. Cytomegalovirus is on there at the bottom. And then you see the reference range, 9 or greater indicates serious risk. And all of these bacteria for me, except for that one there, is above 9. So I had some major issues going on. And I'm not joking. Maybe this is just a what do you call it, a correlation, or maybe this is a coincidence rather. But I swear to you, after that day, after that cavitation surgery that day, I did not have a single heart palpitation since.
So overall, your heart palpitations are feeling pretty good.
It's gone. It hasn't happened a single time. Remember I told you it was happening almost every night, like 8 p.m.?
Now let's go back to the dental cavitation procedure because I
Yeah,
had a wisdom teeth removed. I don't have any soreness though, or any pain in those areas. I know you had a little bit of soreness, right? You be rubbing your jaws a lot. Is that
I
true?
was sore. Yeah, up in just my back jawbone area. Yeah, I was real sore.
And when they ran an X-ray on you and they looked at it, they saw kind of some black spots, like kind of just like hollow black spots on the X-ray.
Yeah, so when they look at the X-ray, you want to try to get a pano X-ray, or you could do a 3D cone beam. It's called a cone beam, like a cone, C-O-N-E, 3D cone beam for anybody
Mhm.
listening. And I just got like a standard pano X-ray, and the guy, as you see his name there, Stuart Nunnally, he looked at the X-ray and he said, "Yeah, I'm 95% confident that all four of your sites are infected." He said the uppers were like 85% confident, but the bottom he was for sure confident because when he looked at the X-ray, it did look black. It looked like necrotic tissue, and he was right. So when he cut
Yeah,
it open, he said that one he had to drill or scoop or whatever he did into either the bottom left or the bottom right, like 14 millimeters or something. He had to go in
yeah.
and get that out.
And I know we got Streptococcus mutans. We have these are the common one that causes cavities right here. Produces a lot of acids that then eat away at the enamel of the tooth. Streptococcus mitis, Prevotella,
Do you know a lot of these?
Spreadia,
Because I know like some of the Klebsiella pneumonia, of course, but
another
some of these I
Klebsiella,
never.
strep, entamoeba, Campylobacter I'm aware of, cytomegalovirus, some of these other ones not quite. I'd be curious to know how many of these show up past, nine's the threshold we're looking here. I'd be curious to know what percent of the population would test positive without a cavitation, meaning above 9 for some of these bacteria.
Well,
I'd be
so
curious.
zero. I mean, zero is nothing, right? And then greater than
Right.
what's it say there? 7.5 is moderate
Yes.
risk, and then nine
Yeah.
is serious risk.
Yeah.
So I bet everybody probably has some of these, but maybe my
Some,
level
yeah.
is off the charts.
And I'd be curious to know that, like, do you even was this like pulled directly from the cavitation spot where they dug in, or did they just do a
Yes.
swab in the mouth, generally speaking?
No, so when he scooped out like the little black necrotic part of the bone, he took that and put that into the tube and sent that off.
Okay, interesting. I'd be curious to know, like, the part they scooped out the cavitation versus just a swab in the mouth, generally speaking. I'd be curious to know what the difference is.
I know. You make a
Yeah.
great point.
I'd be curious to know if they can repeat this one. Maybe they just give you a swab, you just swab your mouth or just swab the general area of your gums and see where that comes back at. That'd be interesting.
I
That'd be a
know.
great podcast.
And then the question is, well, do you approach just the mouth and do like oral rinse, like a silver rinse to get rid of this, or do you go in from the gut and you heal it from the inside out,
You got to do both. And the question is, a lot of these bacteria can emanate from the gut, and the gut's not too far away from the stomach, up the esophagus, into the mouth. So it's not too far away, maybe only a foot or two, right?
Yeah.
So it's still pretty close. And I imagine these microbes could easily migrate up. So I think if you have any oral health issues at all, you really have to work on the gut too. Would you agree?
Absolutely. I mean, it's the first place for any health issue, really.
Excellent. I'm going to go exit back here to our video. Let's see here. Let's stop the sharing. Okay, good. Can
There
you
you
see me?
are. Yeah.
All right, perfect. So in general, I mean, I think you have to address things, topically, orally. I think you can do that with silver, some flushing, some rinsing of the silver. I think you can easily do that with a really good toothpaste as well, like a really good neem / kind of melaleuca tea tree oil kind of toothpaste, where you can brush that, really in there. I think some hydrogen peroxide, 3%. Rinse can be really good. Hydrogen peroxide's excellent at killing all kinds of different things. And obviously do some oil pulling as well, because that oil kind of sucks out some of those toxins. That fat kind of just pulls it out. 10 minutes of flushing of that coconut oil in your mouth in the morning and then just spitting it out. That could be another great way of pulling some of these toxins out. What do you think?
Yeah, I need to call them back and ask them because they gave me a protocol. Because another thing they did right before the surgery was they took a little scoop of plaque down in my gum on my back molar, and they put it under the microscope. And that's where I
Yeah.
told you they found a bunch of spirochetes that were swimming around. Now
Mm.
that doesn't mean Lyme; it just means other type of spirochetes. And they gave me a protocol. I thought it was like apple cider vinegar mixed with hydrogen peroxide. Anyway, I need to get that protocol because they claim that they've created a protocol that can eradicate all dental spirochetes.
Interesting. Well, I know things like cat's claw and cemento are excellent for that too. And I think some of those things that I mentioned will probably be excellent and synergistic with all that. That's great.
Yeah, I have some cat's
And
claw. I have been taking that just because have had several tick bites. So maybe I'm already fixing it and I just don't know it yet.
exactly, it's very possible. Anything else you want to address with your labs before we go on to some listeners' questions?
Well, I would just tell people, if you've had wisdom teeth extractions, and I also had 12-year molar extractions. So I've had 8 teeth removed when the average person only gets 4 removed. So I've had double surgery. And so I was at double risk of cavitations. And so, long story short, if you have had wisdom teeth extractions, if you have health symptoms, whether it's any changes in your weight or energy, or like me, having heart palpitations, I had some blood pressure spikes that were unexplained, I would advise you to just investigate this, get a 3D cone beam or get a pano x-ray and send it to somebody like Dr. Nunnally, who can evaluate this and tell you whether he thinks it's cavitations. It's very common. He says 90% of people who get their wisdom teeth out, 90% of those people have cavitations, which are infections
Wow.
in the old site. So that's pretty darn high. Now, maybe you're so strong, like you personally, maybe you don't have symptoms, but maybe you have cavitations too. So it wouldn't hurt to at least get the pano x-ray and get it evaluated. And then if he thinks it, worst case scenario, he cuts you open and there's nothing there, and then he just seals you right back up.
Yeah, I see Dr. Joan Sefcik, and I know she's skilled at reading x-rays for cavitations, and she's done some x-rays recently. She didn't mention any cavitations. I should have asked, but I think she would have probably mentioned it if she saw her, because I know she's pretty skilled in that. But
You
I'll have
ought
to
to
ask
send
her
me.
next time.
You ought to send me your X-ray if you have like a JPEG image or something. Send me your X-ray because I can look at it. I'm not an expert, but I'd like to just put it side by side with my X-ray and see if it looks same, or does your bone look more white there in that old extraction site?
I'll have to definitely do that. That's a good call.
Because my bone looked dark. Like you could see it. It almost looked like a shadow on the X-ray.
Yeah,
Remember?
it was like white, and then it was kind of like a little bit dark. You could definitely see a shadowing in that area.
You remember I sent it to you, didn't I?
Yep. Mm-hmm.
Yeah. So, I mean, it was pretty noticeable. I mean, I'm not a trained eye on this, but it was noticeable enough for him to be like, oh, 98% confident, you've got it.
Totally.
Yeah, that
makes sense.
That's all I want to say is if you have health symptoms, you work with a practitioner, hopefully a functional medicine practitioner.
Yeah.
If you have lingering symptoms, this may be another root cause for you to investigate. So check it out. Those are called cavitations. Your average dentist likely does not have a clue. So I wouldn't waste your time asking a conventional dentist. It's got to be somebody who's more holistic in nature.
100%. Excellent. Anything else you want to address, Evan, before we go to some of the listeners' questions?
Okay, yeah, one more thing. If they are going to do a cavitation procedure on you, you want to make sure that they do what's called PRF, which is the platelets, where they take your blood, they spin it, they get the platelets off of it, and then they pack your extraction sites. Once they do the surgery, they pack it full of your platelets. That's what they did to me. And like I told Justin when I was in town with them, I only had 1 stitch. So I avoided getting stitches in all of those sites because the platelets make a perfect seal and it heals you up faster. They cleaned it out with ozone, which is also a number 2 important thing. And then number 3 was a vitamin C drip, which acted as like a natural antibiotic for when I was doing all of these procedures and getting all these potential toxins into the bloodstream. I did a vitamin C drip the day of and then a vitamin C drip the next day. I really think that helped me.
I think it did too, man. I like stocked up my fridge here. I remember you grabbed a whole bunch of bone broth, collagen. I think I gave you some of my collagen, right? You were doing a whole bunch of green smoothies and you had a whole bunch of nutrients and good fats and good anti-inflammatories. So you had it dialed in.
Yeah, I did the best I think I could do. I mean, it's not fun, but I had to do it. And now I'm about 99% better.
That's great, man. I love it. Very good. Totally worth it.
But
Anything else you want to address on that?
No, that's it on that topic. Let's go for some questions.
Cool. Are oral probiotics like Salivarius K12 actually effective, or are you better of boosting your GI ones? I'm not sure. I mean, there's lots of different like minutia strains. There's like Lactobacillus and Bifidobacter strains, like Lactobacillus casei, Plantarum, Acidophilus. There's various Bifido ones, Longum. I'm a big fan of just having the broad spectrum Lactobacillus and the Bifidobacter ones. And then there are more nuanced ones that are like spore or soil-based probiotics, which tend to be more sensitive to some of the lacto and bifido ones. The ones that Evan and I use, I think, are dairy-free. The ones I use are dairy-free. I think the ones Evan uses are dairy-free as well. And people that are sensitive to those, there's also delactate-free ones that are specific strains of Lactobacillus and Bifidobacter that don't. And then we have the spore and the soil-based ones, so if you're more sensitive. But regarding our oral probiotics like salivary. I'm not sure about that. Not sure how to answer that one specifically.
Yeah, I think the oral probiotics may be a little bit of a gimmick because your enzymes in your mouth and your saliva may be breaking down those probiotics. So I'd be concerned about the survivability of the organisms, you know?
Oh, we're talking about the probiotics in like the toothpaste. Some like the probiotic toothpaste ones. Is that what he's referring? Okay. Yeah, I mean, I've heard some good things about those, but like you said, right, there's a lot of acidity and enzymes in the mouth, how much of that's getting there. But I mean, I think if you wanted to try a good probiotic or prebiotic toothpaste, I think that's fine.
Well, so what I had in my mind for that question was some of the professional brands you and I use, they do have like lozenges or chewables of oral
Yes.
probiotics.
Yes.
But I don't know what that would do really.
Not sure, but there's definitely some prebiotic too. I would say clean out the bad stuff, feed the good stuff, and then really work on the gut and give that a try. I don't think it's gonna hurt.
Yeah, for sure.
Any thoughts on how to deal with trauma, Bradley? Yes, we've done a couple of different podcasts on this topic, but EFT, NLP, havening, EMDR, these are various techniques. Someone mentioned below my referral for Daniel Hill. Daniel Hill's great. Google Daniel Hill EFT on Google and you should be able to find him. He's excellent. Tell him I sent you. If I have low iron, can I supplement? Does iron feed bugs? I do have a leaky gut, but iron low, even though I eat lots of iron-based foods. So number one, a lot of people are like, don't give iron because you have an infection. It'll feed. Here's the deal, right? Infections are going to feed off of all the nutrients that you have, right? Not just iron. And does that mean you just malnourish yourself just so you can try to, I mean, look at kids in third world countries, kids that are starving. They are still loaded with infections because low nutrients will also compromise the immune system, and then it will make it harder to have a stronger immune system to fight these critters. So I think you need to work on nutrition no matter what, and then you work on killing these bugs. I think trying to starve things out while at the same time starving you is kind of a fool's errand, so to speak. Thoughts on that, Aaron? Evan?
Yeah, I would say with the iron, you could supplement with like something like a lactoferrin. That could be kind of helpful. But I would say you got to look for fixing the infections because if you've got like an H. pylori infection that's reducing your stomach acid levels, you may not be cleaving the iron off of your meats. And so this is a really common problem. And the name is Kitty. So I'm guessing this is a female. You know, if there's any hormone issues causing like excessive bleeding, you know, you could just have that as an iron issue as well. And you have to get your cycle better.
Hemorrhagia issues caused by estrogen dominance. There also could be some type of vegetarian vegan issue going on, or just low stomach acid and enzymes, and you're not breaking down your meat. It could be a combination of all that for sure.
Yeah. So get tested for infections, make sure your hormones are okay, make sure adrenals are dialed in. And then, yeah, you do have to fix the gut issue for sure.
And then Bradley writes in, same kind of question before with the emotional trauma stuff. After a procedure like that, you'd really want to work on the building blocks, the bone broth, the amino acids, the collagen to provide the good building blocks for the tissue, and anti-inflammatory support, whether it's, you know, Arnica montana on the homeopathic side, or anti-inflammatory herbs like liposomal curcumin or frankincense or boswellia. These are excellent. And then also make sure if you had a hip replacement, get to the root cause of why you had a hip replacement. If your muscles aren't absorbing force and that force is going into your hip and your labrum and your cartilage and your soft tissue and your bone, you want to get to the root cause of why that force is not being absorbed properly. So you want to get to that root issue too.
Yeah. Charlie here. What are your thoughts on getting your wisdom teeth extracted? Well, I had to because my wisdom teeth never came out and they were crooked. They were at like a 90-degree angle in my gums, as well as my 12-year molars. I had an old x-ray from back before I got any teeth extracted. And the surgeon who did it said he had never seen a case like mine in 30 years. Like for both 12-year molars and the wisdom teeth to be on their side like this, there's no chance they ever would have straightened out and popped up. So in that case, I had to get them out.
More than likely, there was nutritional deficiencies that have just kind of caused a little bit of a narrowing of the mouth, and there's less space for these teeth to grow into.
I wasn't breastfed. You know, I was on formula as a baby, so I guarantee I was probably deprived. I drank a bunch of sugary sodas as a young kid, so I'm sure I was toast.
Exactly, and that's probably what drove that. And then once you're in that place, of course, you can do all the good cod liver oil and the organ meats and all the paleo type of template, but you have to. More than likely, you're going to need a surgical procedure just because you got what in the chiropractic field we call it limitations of matter, right? The structural tissue just isn't there, so you're going to have to just pull that out. Makes sense.
Yeah. So, I mean, to answer Charlie's question, in terms of getting them extracted, it depends. I mean, if they look okay and they're not causing you any issues, you may be able to leave those in and maybe those wisdom teeth pop in later in life. But for me, I was getting chronic headaches. I had all sorts of symptoms that I had to get them out. They were pushing on my other teeth, my other molars. I was at risk of losing my other molars. Then I literally would have had no chomping power. So, in my case was kind of different than possibly yours, but
Totally. All that steak you would have missed, Evan.
I
So
know.
glad you got them taken care of.
Yeah.
Awesome. Let's keep on rolling here. Hey, Spivey, hope you're doing well. Dr. J, I almost always have very warm feet, which develop after the first hour in bed and last until I wake. When I wake up, never an issue during the day, but when I'm up and about, any thoughts? Not sure. I need a little more information. So it just gets warm when you go to bed. Is it warm during the day? Do you have diabetes? Do you have any blood sugar issues? Is it a peripheral neuropathy issue where it's just tingling? Hard to say. I would need more information. Is it positional where when you get up and move, there could be like so let's just say maybe some scar tissue in the calf area or in the foot area that could be pinching a nerve. It's hard to say. There could be some tissue rubbing up on those nerves. Need a little more intel about that. Vivek writes in, there's some balance between good and bad bacteria in the mouth, and the silver tea tree oil cleanse would disrupt the flora inside the mouth and cavity both. Yeah, I mean, it's definitely possible. Doing a whole bunch of antimicrobial herbs can wipe out some good stuff. That's why you'd want to have really good probiotics going in the background. And if you wanted to get a good toothpaste that had some pre and probiotics, and I think that would be a good balance in between.
It'd be still minimal though compared to like antibiotics. The
Yeah.
good guys that do die from any natural antimicrobials that we use, like if we're working on parasites or something, there are some good guys that die in the battle, but pretty small amount.
Yeah, and again, the herbs that we're using also have some protective benefits. They have a lot of antioxidants that can help prevent toxicity issues and overwhelm. A lot of antibiotics, they create oxidative stress and DNA damage to the mitochondria. So some of the herbs we use are going to have a lot of antioxidants packed in it, which is natural. It's kind of how Mother Nature works. There's a protective mechanism to some of these herbs. So that's kind of the benefit that we have there.
Yeah. You want me to read out Charlie's here? What's your opinion of the finger prick blood draw for thyroid versus LabCorp serum draw? Is it as accurate?
I don't think it's that accurate. I've done both on people and I have seen massive differences. So I would not go with that yet. Yeah. And I think with Theranos, that lady, she's a multi-billionaire, but getting sued now because of all the fraud in the company. That was just totally, she made up all the stuff. And I saw patients that got the Theranos pricks and did, some of the LabCorp standard testing. You just need more blood to get a good sample of it. And from what I found, people's levels were off by a factor of 2 or 3 on the Theranos finger prick test.
Yeah, that's scary. I mean, that could change the whole course of everything because you may think something's off when it's not, or something's good when it's not. I mean,
yep, exactly.
So conventional blood draw then.
Yeah, exactly. What are possible causes of low testosterone? 400 in a 34-year-old male. I mean, let's just start with poor sleep, poor diet, insulin resistance, poor nutrition, poor digestion, increased toxicity, increased, estrogen load from the environment. I mean, those are the top 7 things I could say off the bat.
Yeah, well said. Plastics, exposure to
that's estrogens. Soy.
Yep, soy is a good one.
Yep.
Any type of medications. Mm-hmm. So, I mean, all sorts of different pharmaceuticals could affect and lower testosterone.
Yep.
I would say lack of exercise could do it too. I mean, that'd be a simple one. If you're just too sedentary, testosterone tends to drop. Adrenals, did you mention adrenals?
Yeah, I mean, I think that would be the end result out of all this stuff.
Yeah.
The end product of all those stressors would cause adrenal dysfunction, thyroid dysfunction, low testosterone. Of course, all those are the end result for sure.
Yeah.
Oliver writes in, opinions on tattoos, they bad for health. There's a couple of different. So some tattoos, they have corn starch in there or some corn-based derivative in there with the dye. So if you're very gluten sensitive, there may be some type of issue with that. Hard to say. Some involve specific metals. Metallic compounds. I mean, I would personally stay away unless you can try to get some kind of natural dye. I mean, it just depends. The healthier you are, probably not an issue. The more unhealthy you are, could be an issue. So not an expert on that topic, but you'd want to make sure that you figure out what types of dye you'd be getting and figure out what options you have. I imagine there's probably more natural alternatives out there. But I guess if you really want the tattoo to look good, you'd have to weigh the difference between how it would look versus, the toxicity aspect.
Yeah, just like hair dye, there's like organic hair dyes, but how does that work compared to like a conventional chemical hair dye that's toxic for you? I mean, I don't know. I'll read this next one here from Neem. Is it better to avoid keto with unresolved infections / parasites?
I think it depends. I think keto is great because most people are insulin resistant. So keto does help reduce insulin resistance. Again, some people can just cut their carbohydrates. They don't necessarily have to go into that full ketogenic state, and they can get a lot of the same benefits. Maybe you cut your carbs down to 50 or 75 grams a day of whole food carbs. That may be enough to fix a lot of the issues. Infections and parasites tend to like the easier metabolized fuel sources like sugar. So, of course, going ketogenic or lower carb tends to cut all those things out because it's impossible to be in ketosis while sugar is in there. And then number three is if you have infections, sometimes your digestion is going to be off. There's going to be lower enzyme and hydrochloric acid levels. So more protein and more fat can actually reveal a weak link in the digestive chain. So sometimes people feel worse going keto, and that may just be because your digestion is now fully magnified because of all the protein and fat, and that low hydrochloric acid and enzymes now really shows itself. So if you did it, you'd want to make sure hydrochloric acid enzymes, maybe bile salts are there, make sure your stools are sinking, and make sure you don't see a whole bunch of particulate of food in the stool.
Yeah, my experience with the keto with infections, it didn't go well for me because my blood sugar was affected too. I had H. pylori, so that was messing up my stomach acid levels. So I kind of crashed and burned a little bit when I went keto. So for me, I was having to do basically 3 meals per day, sometimes snacks, and I was doing starch, sweet potatoes, organic rice, etc., just to try to keep myself stable. Once I cleared out the infections, though, I feel much, much better at a lower carbohydrate. So I agree with you. It's like these type of questions, there's so many different caveats. We could spend a whole hour just on that topic, but it's never going to be black and white. You've always got to figure out what other body systems are affected and then what's the status of those. Because if you have weak adrenals like I did, maybe those infections screw you up a bit more and you couldn't go to a keto. Maybe you couldn't adapt as well as you'd like to.
Yeah, and some people they forget. They think, oh, like I'm going to go ketogenic, and the whole goal is I'm going to restrict carbohydrate consumption, and I'm going to go into ketosis. People don't understand that when you go into ketosis, you also go into typically gluconeogenesis, and your body may overproduce carbohydrate in gluconeogenesis versus if you actually ate a little bit more carbohydrate. So, in other words, let's say as you go into ketosis, you start going into gluconeogenesis. Let's say your body makes this much sugar from protein or from your muscle sources. But let's say if you were to eat this much carbohydrate, that may decrease the difference between the top and the bottom. Sometimes eating a little bit of carbohydrate can decrease the excess carbohydrate you make endogenously. Does that make sense?
Yes, it does.
Okay. So keep that in the back of your mind.
I'll go for this other question here.
Yep.
We talked about the testosterone already, so let's move on to the one from Vivek here. Does die-off happen every time to each and every one, or is this something that happens to some people, not everyone? I'll give my 2 cents first here, which is that my opinion is kind of that die-off is a myth, not in the sense that it's not real, but in the sense that it really shouldn't happen. And so many practitioners push people like, yeah, keep going, die off. We must be killing the bugs. And it's like, no, that's your body telling you something's not right. So whether that means you're going too fast, you're going too hard, your liver's overburdened and can't keep up with the toxic load, the adrenals are too weak, something's not right if you have die-off. So I don't think it should happen to anyone.
I'm doing my GI Clear 1, 4, and 5 right now. I'm doing a parasite cleanse, and I'm having 0 die-off. Okay, now some people have die-off, and again, in my die-off reaction handout, if you're a patient listening, the biggest thing the patients do that drives me nuts is they push in a die-off, and they feel like crap, and then we chat, and they're like, oh my God, this is so bad. I'm like, did you see the die-off reaction handout? Did you see where it says work up to, a negative, full dose or a negative symptom, and if a negative symptom happens, back off until it stops. And again, we typically throw in ginger tea, which helps with anticoagulation. It keeps things flowing. It keeps the sludge moving. And we may add in some binders as well. So we have strategies to do it, but we never want to push into that place. Now, if some people feel a tiny issue and it's not that big of a deal, maybe like a 10% drop in energy, fine. But if it affects your quality of life, you got to calibrate that dosage to what you can handle, find that dose that works, and then every week try to work up without having those negative symptoms.
Yeah, and I just tell people too, you're not going to win a trophy if you go straight up to the full dose of something we recommend. So if we're
Bingo.
saying to do like 6 a day of some formula, maybe you start with 1 a day and you work your way up over 2 weeks. Like if you go straight to 6 a day of an antimicrobial, yeah, even if it is natural, you may feel it. So we're not in a rush with this stuff. And some people get in a rush. They see these bugs. They're like, okay, get it out. And they just want to do the protocol. But there's an order of operations that we follow in functional medicine, and that's for a reason.
Exactly. And I see Jeff on the YouTube thing here. Jeff, that's your reason too. You got to slow it down. We got to check in and see where you're at, man. So make sure you reach out. Yeah. And then anything else you wanted to say there? Any other questions?
No, that's it for that one. Let's move on to another one.
Cool.
Let's see. On many collagen supplements, especially fish, it says not to mix with other protein as they hinder or compete with collagen absorption. Your thoughts?
I don't really know what to think about that. I mean, personally, all the amino acids are going to get absorbed. So I'm not sure what that thought process is. I wouldn't personally worry about it. I mean, if you eat a piece of beef and a piece of chicken, you know, those all get broken down into amino acids and they'll all get absorbed. So of course, the more amino acids you have in there, you know, the more competition in general. But, you know, in general, it just takes longer to break those things down. If you're taking a collagen support, it should already be in a peptide form, ideally, if it's good, and it'll be very easy to absorb. So I wouldn't worry about it personally.
That's minutia. I mean, that's not going to change anything.
Yeah, I mean, people, you know, they try to like nuance things out there and make it more complicated or more different. But in my opinion, I think that's not a deal breaker.
Yeah, I would agree. You want to hit this one with Ronan here?
Yeah. Partner has Raynaud's. What can you do to help with that? Well, what's the cause? So Raynaud's typically has an autoimmune component. There's typically Hashimoto's involved with it as well. So you want to make sure you get to the root cause. So gluten sensitivity, maybe a gut infection, maybe autoimmune Hashimoto's. Got to get all those things looked at.
Yeah, run blood, stool, urine. We're going to look at saliva for adrenals. We've got to clean up the diet piece. We've got to remove bugs if they're there. And you can fix Raynaud's. I mean, it's not a lifelong thing.
I've helped dozens of people reverse the Raynaud's.
Yep.
All right. I don't tolerate bone broth or anything with high glutamine. I have low serotonin due to the kind of urine pathway. CNS inflammation due to the high C4A, history of mold. Do you think SBO probiotic would help?
The soil-based, I'm guessing.
Soil-based, yeah. Soil-based would be good, or spore-based would be good, or potentially a delactate-free would be great. I would look at those 3 types. Megaspore is a pretty good one for a lot of patients that have chronic issues. They can tend to do well with that.
Yeah, here's another one here. Are proteolytic enzymes effective on the mouth as well?
Not sure about that. I mean, proteolytic is going to be more protein-based. Protein digestion happens in the stomach. A small amount of carbohydrate breakdown happens in the mouth. So I would probably say no on that.
Yeah. Kurt, what's the best test for leaky gut? I mean, you could do an intestinal permeability screen, which could be done in a couple ways, blood or stool. We mainly just assume that there's a leaky gut situation based on the IgA levels that we can see, plus the infections that are present. So if you've got a bunch of parasites and yeast and bacteria on your stool panel, plus low IgA, probably a leaky gut situation. You could pay the extra $700 to confirm, but kind of unnecessary.
Yeah, there's 3 major tests. There's an add-on we do with the GI map called zonulin, and zonulin's a protein that goes up with intestinal permeability. That's number 1. Number 2, there's an old test that's been out for a while called the lactulose mannitol test. Lactulose is a very large sugar molecule, so if that decreases, so you take a solution, you collect your urine, and you want to see that lactulose in the urine. If it's not in the urine, then it's basically assumed that there's a leaky gut because that's been absorbed, where the smaller mannitol should be absorbed. So when you see a discrepancy where you see the large lactulose have decreased absorption in the same area of the mannitol, that's what tends to say leaky gut. So how it works is more of the lactulose should be in the urine and less mannitol. But when you see kind of an equal amount and they're both low, that tends to mean leaky gut. And then number 3 is a test by Cyrex that looks at occludin and zonulin, these various tight junction proteins. And when they show antibodies to it or increase in LPS, lipopolysaccharide antibody, that can also be a distinguishing factor of leaky gut. Leaky gut's an effect, not a cause. So we don't necessarily need to look at the effect. We look at the causes of it, and we just assume that this is already happening because the cause is here.
Yeah, a lot of people like to run that just to sound fancy and smart. Oh, let's test you for leaky gut. It's kind of irrelevant, really. You got to clear the bugs.
Yeah, I mean, I call it circumstantial evidence, right?
Yeah.
Let's say, the direct evidence is the zonulin, is the occludin, is the lactulose mannitol. If I'm in my house, I don't have a window outside, but I hear lightning and thunder, and I hear rain coming down my roof. Do I actually need to see that there's rain and thunder happening?
No.
Not necessarily, right? I can just hear it. So that's kind of what we're doing with some of these things.
Yep. Let's hit up this question here about blood work. What blood work to test for insulin issues?
Fasting insulin would be great. You can also do a functional glucose tolerance test. Take your blood sugar before a meal. Do a 1, 2, and a 3 hours. That'd be excellent.
Here's a question from Gabe. Evan, how much weight did you lose when you were sick? And what did you do to regain your weight? I lost like 25 pounds. I was like 160. I think I got down to maybe 135, something like that. And what did I do to regain my weight? He spelled what. He did put an H there. What did you do?
You missed it. What?
Anyhow, I had to clear the gut bugs. And Justin was the guy who looked at me and said, hey, man, you probably got parasites. You need to test your stool. And I was like, okay, I'm going to listen to you because you're a smart guy. So I tested my stool. Sure enough, he was right. I had parasites. So I had to get rid of the gut bugs so that I could regain my weight.
And you may have to make sure you're getting enough nutrition. Like you may have to measure your calories. And again, calories are just an easier measurement of the nutrition, right? So if we're eating whole foods, there's going to be calories in whole foods. We make sure we're eating enough whole food calories. And then number 2, we may actually give some extra free form amino acid and nutrient sources that are pre-broken down so it's easier to digest. And then, of course, make sure that you're eating with HCl and enzymes and bile salts to make sure you can break those foods down, and keep an eye on your stool. Make sure you're not seeing food particulate. Make sure the stools aren't floating. Make sure those things are there. And, if you're getting nauseous and bloaty after the meal, you can try going a little bit smaller and more frequent meals to make it easier on the digestive process.
Yep. I'm getting muscle back. I mean, I'm not back to the full size, but I've got something here. I've got a little bit of gun show going on. I'm hitting the weights back though. I'm slowly building back up, and I am feeling stronger than I have in a while. Let's hit this. There's more coming in, more questions coming in. I know you've got a roll. I've got a roll here, but let's hit this one from Vivek, and then we can wrap up. Does feeling sleepy after eating food mean that your blood sugar is getting too high?
Yeah, 2 scenarios. You ate too much carbohydrate, or you ate too much food in general.
Or
a bigger meal. If you go and have like a 20-ounce steak right now, you're probably going to feel a little tired afterwards, even if it's like a steak and veggies.
I would say low acids and enzymes too, though, because like when I had H. pylori, if I would even eat a small meal, I was exhausted.
Yeah, indigestion. Well, it makes sense, right? Because a large amount of food is going to put stress on those digestive systems. But even me, like if I go and have a 20-ounce like porterhouse something, and I do a lot of enzymes and HCl, I still may be a little bit tired. But yes, I agree. Insufficient digestive juices and enzymes and acids, too big of a meal in general, and then just too much carbohydrate, especially if it's refined. You get this like buzz right afterwards, and then you crash an hour later.
Yeah. So I would say, I would agree with you. Make sure the meal size is not too big. There's that Japanese proverb that says, fill yourself with 80% food and 20% air, something like that. So basically, don't be a glutton and stuff yourself.
80% full is pretty good. Your brain takes about 10 minutes to catch up with your tummy. So always err on the fact of saying, hey, I'm going to just stop for 10 minutes. And if I'm hungry, then I'll go back and have some more. I think if you do that, it tends to be helpful.
Yep. James had a question. I'll just answer this one here. He said, is there any way to order tests without a follow-up appointment? Can I get test results emailed to me? Yes. Justin's team, my team, we both can provide testing. However, why would you want to do that? Because you need us to help you make a protocol based on your results. Unless you're just so smart, you can figure it out on your own. That's fine.
I think it's always good at least scheduling a quick follow-up to review it, because especially if there's any infections that come back, you want a strategy and a plan. Again, if nothing comes back and it's super easy and simple, that's fine. But a lot of times you just don't know what that case is. So it's always good to have just a quick little check-in for that for sure.
Gabe said next time we get together, we should do an arm wrestling match. I don't know, man. My wrist is kind of weak because I was doing like a lot of heavy lifting. I think you'd probably break my wrist. Your wrist looks a little bigger than mine.
Yeah, maybe right. Maybe right.
We'll try it.
We'll do it, brother. I love it. Any other questions, comments, or concerns?
That's it for today. So you guys take care. If you want to reach out, schedule a consult with Justin, you can do so at his site. That's justinhealth.com. Reach out. And he's got another doc on staff too. So if his availability is crazy, you can get in to see his other doc sooner. Check out my site, Evan Brand, EVAN, last name Brand, BRAND.com. And you can schedule a consult there. And I've got a gal who's also functional medicine certified as well. So if my availability is crazy and you want to see somebody, then we're here. So you guys reach out. And I mean, look, we love people doing it themselves, but at a certain point, you've just got to get the data. I mean, we're biased. We love data, but without it, you're guessing. So it's like, oh, should I take this supplement for my testosterone? Should I buy this magic collagen powder? The answer is like, maybe, but get yourself tested, figure out what's going on first. Cause you can take somebody mentioned some herb earlier for testosterone, tribulus. You can take all the tribulus in the world, but like if your digestion sucks and you've got way too much estrogen, you've got to fix that. So work on that.
Totally. I think that's a great idea. Give us a thumbs up, hit the subscribe, hit the reminders button. That way you can be present with these chats. Again, if you really enjoyed it, give us a share it with your friends, sign up at the Candida Summit, justinhealth.com/Candida. And then my thyroid summit's coming this fall, thyroidresetsummit.com.
All right. Excellent. Thanks for your support.
Hey, Evan, have a good one. Take care, man.
Take care. Bye.
Happy 4th. Bye.
You too.